Welcome to the University of Cincinnati Internal Medicine Residency Patient-Centered Rounds tutorial entitled Involving Friends and Family During Bedside Rounds. After this presentation, medical teams should be able to organize before entering the room, identify who is in the room with the patient, and determine the patient's preference regarding family members and friends during the encounter. Bedside patient-centered rounds have many advantages. However, one of the dangers is that you might enter a room and begin speaking with the patient before you acknowledge the people in the room.
Come in.
Mr. Smith.
Hi.
Hi, how are you?
I'm here. How are you?
Okay. Dr. Blue's going to give us an update. Tell us what's going on with you.
Mr. Smith, when you came in, you weren't feeling so good. We did some labs. Your liver enzymes were elevated. Looks like you have hepatitis C, most likely from shooting up. Hate to break it to you.
Excuse me. Shooting up? Shooting up what? Is this something I can get?
So, you know,
Is this something I can get?
I'm not sure.
often sharing needles can give somebody hepatitis C. So I don't know if you have any partners that you share needles
I am
with.
calling my divorce lawyer.
Obviously, this is a dramatization, but if you're not careful and mindful of the people in the room, these kind of things can happen. Patient-centered teams should identify who is in the room with the patient and determine the patient's preference regarding family members and friends during an encounter. In the next vignette, observe how the team organizes before entering the room, identifies who is in the room with the patient, and determines the patient's preference regarding the family member during the encounter.
So who do we get next?
So Mr. Patel's next. He had the transaminitis.
Find out anything new?
Yeah, it turns out he has hepatitis C. I haven't told him yet, so I was going to go chat with him.
All right, let's just make sure we know who's in the room.
Sure.
Come in.
Mr. Patel.
Hi.
Hey, it's Dr. Blue. How you doing?
I'm doing well. How are you?
Doing fine, doing fine. I don't think we've met yet.
Hey, I'm Mrs. Patel.
Hi, Mr. Patel. I was wondering if I could take a minute to just talk with Mr. Patel alone for a second, chat with him a little bit.
Okay.
Sure. Thank you. So, Mr. Patel,
Yes.
I know you came in feeling sort of crummy. We did a whole lot of tests. We found your liver enzymes were elevated. And with some of the history we talked about yesterday, we found out that you do have hepatitis C as a cause for your liver troubles.
I see.
Yeah.
How can you get that?
There's a lot of ways that people can get hepatitis C. To be honest with you, the most frequent is IV drug abuse,
Okay.
from sharing needles and things. And I know we talked yesterday about how you had used some heroin in the past, right?
In the vignette, the team organized before entering the room. The attending physician asked who was in that room, and Dr. Blue found out. He then identified who was in the room with the patient and asked that family member to leave when sensitive information was given. This is sometimes appropriate, especially if the doctor and the patient have decided ahead of time what information will be given and when. In this way, the physician has determined the patient's preference regarding the family member during the encounter. Thank you for watching the University of Cincinnati Internal Medicine Residency Patient-Centered Rounds tutorial. If you'd like to see other tutorials in this series, please use the search term UCINTMED in YouTube.